Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey, welcome back to Between the Sheets podcast. Today you're going to have to listen to just me, no guests today, but I do have a great topic lined up for you. We're going to talk about low testosterone. We're certainly going to focus on the men here, born male, that is, transition people, male and female transition. You have your own set of guidelines for hormone replacement and things like that. So for the topic of today's conversation, when I'm talking about males and females, it is born male, born female. So that way there's no confusion there. I hope you guys are all doing well. I'm very excited to talk to you about this topic. I have a lot of patients that I see for low testosterone. I see males for low testosterone. I don't see women for low testosterone right now, but there are plenty of issues with women having low testosterone and places for women to get treated. So we'll touch on that towards the end as well. So what is low testosterone? Low testosterone is also known as testosterone deficiency or hypogonadism, and it is a condition in which the body doesn't produce enough of the male testosterone. Testosterone is the main androgen. It stimulates the development of the male characteristics, and it is essential for sperm production. The levels of testosterone are naturally much higher in people assigned male at birth than those assigned female at birth. So testosterone in men helps maintain sex organs and genitalia, muscle mass, adequate levels of red blood cells, bone density, a sense of well-being, sexual and reproductive function. So the body tightly controls the levels of testosterone in your blood system, and they are at their highest in the morning. So when we diagnose men with low testosterone, they have to be low in the morning when they should be the highest. And then the testosterone declines throughout the day. The hypothalamus and the pituitary gland, which are up in your brain, normally control the amount of the testosterone that your testicles produce and release. The hypothalamus releases what's called gonadotropin releasing hormone, or GnRH, and this triggers your pituitary gland to release LH, the luteinizing hormone. LH then travels to your gonads, which are your testicles or your ovaries, and stimulates the production and release of testosterone. So your pituitary gland also releases what's called the follicular stimulating hormone, or FSH, and this causes sperm production. So any issues related to your testicles, your hypothalamus, your pituitary gland can cause low testosterone or male hypogonadism. The American Urology Association considers low testosterone to be less than 300 nanograms per deciliter total testosterone in adult males. Some research and healthcare providers, myself included, think that this number is great for a guide, but that we should also be looking at our patients' symptoms and treating more on their symptoms than their exact number, with keeping safety guidelines and such in mind to not give someone too much or too little testosterone, of course. Some providers feel that less than 250 is considered low. I would say in my guys that I have in practice, by the time they're at 300, they're feeling pretty crummy. And so waiting till they get to 250 for me is generally not going to be the issue. It's if they're symptomatic, I'm going to want to be treating them. But as far as insurance coverage and the technical definition of low testosterone, it's less than 300 total testosterone, checked between 8 and 10 in the morning for that boost and getting you at the climax of your testosterone and making sure that you're low at that time. So who's at risk for low testosterone? It can affect you with your age. So as you get older, you make less testosterone. If you are obese, you're going to make less testosterone. Poorly managed comorbidities, especially type 2 diabetes. Obstructive sleep apnea that is not treated. So we definitely want you getting a sleep study and wearing your CPAP machine if you need one. And other chronic medical conditions like kidney dysfunction, cirrhosis of the liver, HIV, or AIDS. So there's lots of different things that can contribute to the low testosterone and put you at risk for it. It is very common. About 2% of males have low testosterone. That's kind of what the general data suggests. There have been a couple studies that show that more than 8% up in the age range of 50 to 79 have low testosterone. So the general guideline is about 2% of all men. And then our older men, you're looking at about 8% of men with low testosterone. So there are several possible causes of low testosterone. We can have primary hypogonadism, which is a testicular disorder. And then secondary hypogonadism is when the pituitary or hypothalamus are having some dysfunction. So primary gonadism, hypogonadism, happens when something is wrong with the testicles that's not allowing them to produce normal levels of testosterone. So here you have your pituitary gland producing more and more of the luteinizing hormone and the follicular stimulating hormone in response to these low levels. The high levels of these hormones that would normally tell your testicles, hey, buddy, let's go, kick in, let's shoot out some more testosterone, make some sperm. But if you have some damage to the testicles, you can have crazy high levels of the LH and FSH and not getting the response of your testicles to produce testosterone. So they can make too little, and they can also make too little sperm. So normal ranges of gonadotropins can be high gonadotropins. Testosterone levels could be within normal limits, but these other levels are high. So we can kind of work through those and kind of pick apart whether your symptoms are because your testicles aren't producing enough or if something else is going on. There are some things that you could be born with that could lead to primary hypogonadism. So these are congenital, right? Born with. So that could be the absence of testicles or undescended testicles. We definitely want to get those down if we can so that they can be healthy and produce sperm. Klinefelter syndrome is a genetic condition that can do this. Noonan syndrome, myotonic dystrophy, again, an inherited disorder with in the realm of the muscular dystrophies. Acquired conditions that affect your testicles could be a testicular injury or a removal if you had testicular torsion and we actually had to remove one of your testicles, orchitis, which is inflammation. It can be on one side or both. This is usually a bacterial infection and we can get it treated very quickly. But if you don't get it treated, it can cause some issues there. Chemotherapy or radiation to your testicles. So if you have testicular cancer or another cancer in that area that you're getting radiation that gets to the testicles, that can affect it. Certain types of tumors, anabolic steroid use, meaning you are using testosterone when you don't really need it. And you're trying to get this boost in your muscle mass and your energy level that can, when you don't need it, can end up causing low testosterone. So conditions that can affect the secondary hypogonadism. So this is where there's something with your hypothalamus or pituitary gland, and these are causing low levels of LH and FSH, which then tell your testicles to not produce as much testosterone. So again, there's things that you can be born with. You can have isolated hypogonadotropic hypogonadism, which is just low levels of these hormones from birth. Kalaman syndrome, which is again another genetic condition. It's pretty rare. And then Prader-Willis syndrome is also a genetic multi-system disorder, and it affects the hypothalamus. So that can then in turn affect your testosterone levels. Acquired conditions for the secondary hypogonadism, hypopituitarianism. So an adenoma or something on your pituitary gland that is making it not function correctly could also be from radiation or surgery that affects your pituitary gland. Hyperprolactinemia, too much iron, brain injury, head injury, Cushing syndrome, cirrhosis of the liver or kidney failure, HIV and AIDS, alcohol use disorder, poorly managed diabetes, obesity, and obstructive sleep apnea. There are also medications that can put you into low testosterone, psychoactive drugs, opioids, leuprolide, which is something that we use for prostate cancer to decrease your testosterone production. You can also have a late onset hypogonadism, which is just results of normal aging. Males that age have a deteriorating hypothalamic and pituitary function, and that can decrease both testosterone and sperm production as well. In one study, 30% of males who were overweight had low testosterone compared to only 6% with normal weight in the normal range. And another study had 25% of males with type 2 diabetes had low testosterone compared to 13%. So really keeping yourself in a healthy weight and healthy comorbidities is big for the secondary hypogonadism. So what are some symptoms of low testosterone? This can vary from person to person, from age range to age range. And of course, this podcast is not geared towards children. This is a very adult podcast. So I'm not going to cover low T in kids, but definitely if you have concerns there, you can talk to their pediatrician. This specific talk is going to be looking at our adult males. So symptoms like reduced sex drive, decreased libido is another way to say that, erectile dysfunction, difficulty either getting or maintaining or both your erections, the loss of armpit and pubic hair, shrinking testicles. If they are not working hard enough to produce the testosterone, they will get smaller. You might have hot flashes, zero or low sperm count, which obviously affects fertility issues in men. So if you're getting a sperm analysis and you're low, that could be an indication. The depressed mood, difficulties concentrating in memory, increased body fat, difficulty gaining muscle. Some men will have some engorged breast tissue, which is called gynecomastia. And you can also have like decreased endurance. A lot of my guys will describe this as, I just don't have the same stamina that I used to have. So how do I diagnose it? We do blood tests. We do blood tests of total testosterone. Again, like I said earlier, we check this in the morning when you should be peaking, so between 8 and 10 in the morning. And if you are sick or have recently been sick, it's important to tell your provider because you can get false lows if you've had a recent illness. We'll also test different hormone levels, like your LH. We'll test your prolactin level. That way we know if the pituitary gland is functioning correctly or not. If your prolactin levels are severely off, we might have you address possible pituitary issues before we get into treating the low testosterone. We might ask you to go get tested for sleep apnea. We'll check your thyroid to make sure that's not contributing to your overall symptoms. We can get both the total testosterone and the free testosterone. Currently, the diagnosis is only based on the total testosterone. But it certainly is helpful to know all of your numbers, especially at baseline, because then we know what we're doing with treatment as far as like, are we getting you high enough? Are we getting you too high, too low? Where is your comfort level? So for low testosterone treatment, we replace the testosterone. Now, replacing the testosterone is in many ways, but the biggest thing that we're going to ask first is whether or not you're still trying to make babies. Testosterone replacement with synthetic testosterone can affect your sperm production and make you infertile. It can come back if we take you off of the testosterone, but generally we don't want to take that risk. So if you are on the younger side, 20s, 30s, 40s, and still trying to have children or still want the possibility of that, we would probably suggest starting with a medication like Clomid, which can help increase your body's natural production and natural functioning of your hormones. And so that can be a great option for guys who still want to protect their fertility. If we're no longer considering issues with fertility, then we go to synthetic testosterone. So there's gels, shots, pellets, there's pills, there's all kinds of stuff. So I'm going to kind of break them down for you. First of all, we have testosterone gels. You apply the gel every morning. It gives you a nice boost. It wears off while you're sleeping, kind of very similar to your normal testosterone flow throughout the day. Wake up the next morning, put it back on. You can put it on your major muscle groups, your inner thighs, your chest, your shoulders. It's one of the most common forms. It's cheap. Insurances cover it. It's very easy to put on. You don't have to have any needles. You don't have to dispose of needles, things like that. Excuse me. We don't want you to transfer it to kids or a female. And so we do want you to be intimate with a shirt on if you put it on your chest and shoulders, or just take a quick shower and wash it off. That way you don't have to worry about it. And also don't want it transferring to kids. So if you put it on your inner thighs and you're wearing shorts and then a grandkid comes and sits on your lap or whomever, you don't want it to transfer. So just being mindful of that. That's kind of the downside of gels. I do have some guys that get rashes or dried out skin from it. But overall, it's really well tolerated and it's very easy to use. It's easy to travel with. So a lot of my guys really like that option. We can also do injections that you do at home yourself. You can come into the clinic and get them done as well, but it's a lot more convenient if you learn how to do them yourself. You're going into major muscle groups. Usually men are using their thighs or their buttocks. And you can do this. Depends on how we have you on it. We usually do once a week. Some guys that don't need quite as much of a boost will do every other week, or maybe they have other risk factors that we're concerned about their testosterone getting too high. I also have guys who are really sensitive to the peaks and valleys, and then we can do smaller doses more often, every 3 to 5 days or something along those lines. So it kind of depends. You'll work with your provider on that and do those, but generally you do those to yourself at home. There is a longer acting injection that we do in the office for you. It's every 10 weeks. So guys who, don't necessarily want to do the gel, but don't want to give themselves injections either, this is a great option that we can help you with in the office and not bringing you in every week to get an injection, but every 10 weeks. There are testosterone patches. It's not something that I frequently prescribe. Live and work in an area where we have a lot of men who work in very sweaty type of jobs, very labor intensive. And so it's not really going to be great for those guys who are sweating a lot. We have a lot of athletes in the area as well. And so that's really not who I'm prescribing it for. But if you have an office worker or somebody who just is really needle phobic and the gels are too easy to transfer, they got little kids that they're around, things like that, a patch might be a great idea. Some guys get irritation at the site of the patch. And one of the tricks that I have learned from other providers is if you get some Flonase, yes, the nasal spray, and you spray it on your skin and let it dry before you put the patch on, that can help if you have kind of a contact dermatitis with the patch. So it's kind of a nice little option, little side tip for you. Testosterone pellets. The brand that is out there that we use most often is Testapel. And these are pellets that we bury in the fat of your butt cheeks every 3 months. Some guys are a little longer, but about every 3 months is kind of what we're shooting for there. They dissolve over time slowly, so you don't get quite the peaks and valleys of the injections. You don't have to be giving yourself shots all the time, but you do have to come into the clinic and have it done 4 times a year. Some guys tolerate this really well. Some guys don't. It just depends on you and your person. After several years, you might be developing some scar tissue in that area, so we kind of have to manipulate where we inject the pellets. But it is a really great option. My guys who are on it love it. We can adjust the amount of pellets that you get to get you to the right amount of testosterone. I usually have my guys start with either the shots or the gels first, just so that they can make sure that they like the way they feel on synthetic testosterone, because the pellets do have that longer lasting, that 3-month effect. And so if they don't really like it or they're not tolerating it well, sorry, we'll see in 3 months. Whereas if they've started on the shots and the patches or the gels, they have a better understanding of how they feel on testosterone, which can be a good thing. There are also, there's a company out there that has a nasal gel. It is nice because it does protect fertility, but you do have to do it 3 times a day, which is a little excessive, I think. Most of my guys don't want to have to try and remember to take it to work with them or whatever. And so that hasn't really been something that I have used a lot, but it is an option. And from my understanding, works very well and is a nice alternative to the Clomid, which can be hard to get and expensive. So if your guys are looking to preserve fertility, that might be an option for them as well. And then finally, we do have pills that you take twice a day. There's a couple of different brands out there. This is nice for people who travel a lot, who have low testosterone for particular conditions or tumors that maybe need a little bit more of a consistent level in their body. I have found that insurance doesn't pay for it quite as much, or you have a higher copay, but some of the companies do have some coupon programs out there for you. So that can be a great alternative as well. I do have the guys that I have on the pills like it a lot. They don't tell me about any side effects. So that can be a really great thing as well. So, are there any guys who can't take testosterone therapy? Well, sure. Sometimes it's not appropriate. One of those situations is during prostate cancer treatment. We know that prostate cancer is fueled by testosterone. It doesn't cause it, but it can make it grow faster. That's what the research shows us. And the way that we treat prostate cancer is by taking away your testosterone for a specific amount of time, depending on the level of testosterone, if that's the method of prostate cancer treatment you choose, and that's a whole nother discussion. But it's certainly something that we take into consideration. That being said, I do have guys who are post-prostate cancer treatment that are in a safe area that we can put them on testosterone therapy. I even have some guys that are on active surveillance for prostate cancer, meaning it's a very small cancer, very minimal. We are not doing treatment at that time, but they are monitored closely, and we keep an eye on not only their testosterone levels, but their cancer levels as well. And we make sure that they're safe. And so that's an option. So we just have to be a little bit more careful. It's not a 100% absolutely no, but it is one of those things that we may say no for a particular amount of time. If you have an unevaluated lump in your prostate or in your testicles, we would want you to have that fully evaluated first before we decide whether or not we're going to do testosterone replacement for you. If you have breast cancer, we do not want you to be on testosterone replacement therapy. And yes, men can get breast cancer. Make sure that if you feel a weird lump or bump, go get a mammogram. It is not weird. Men get them all the time. Go for it. Uncontrolled heart failure, as well as untreated obstructive sleep apnea. Those are also conditions in which we want you to get those controlled first before we're going to consider testosterone replacement therapy. Side effects, obviously, depending on the type of replacement you use, can have an issue. So like I mentioned earlier, the gels might give you a rash. Same with the patches. The injections, obviously, you might have some injection site pain. But generally speaking, regardless of the form of testosterone that you're taking, you could get acne or oily skin, could have swelling in your ankles from mild fluid retention, stimulation of the prostate, which can make it grow, can also have the cancer there. So just being cautious of that. We do have some men that get gynecomastia from this. It's not very often, but it can happen. And generally, it's not reversible once it happens. Worsening sleep apnea, that's why we're so imperative that you get it treated first and get on good regimen with that. You can get smaller testicles. Like I said earlier, if your testicles aren't producing testosterone and sperm, they're going to get smaller. Well, now we're giving you synthetic testosterone, so your testicles don't have to make it. So they could potentially get smaller. And then skin irritation, like I mentioned, we are going to monitor you while you're on treatment. For my guys, we monitor every 6 months. But if I'm starting you or changing you on a type of therapy, I'm going to check you in about 6 to 8 weeks and do that until we get you where we want you in your dose adjustment. And then we would transfer to every 6 months. So we're going to check your PSA, which is the blood test for prostate cancer. We're going to check your red blood cell count because testosterone does aid in your red blood cell production. We want to make sure that that's not getting too much for you. And so we keep an eye on that. If your red blood cell count gets too high, we certainly tell you to go donate blood. If you're not able to donate blood for whatever reason, you can get what's called therapeutic phlebotomy, where you go to a blood doctor, a hematologist, and they remove a certain amount of your blood every so many weeks. And that can help you stay on your testosterone therapy. You can also have a decrease in sperm count, which can produce infertility. So that's one of the things that we make sure that we know about prior to prescribing any type of testosterone replacement, is to know whether or not you are still trying to be fertile. Generally, let's see, what else do we want to talk about? Can it be prevented? I mean, that's a great place to talk. Healthcare providers and researchers were not exactly sure how to prevent it from certain genetic conditions or damage to your testicles, but certainly lifestyle habits that can help keep testosterone in the normal ranges, eating a healthy diet, getting some good exercise, having good weight management, avoiding excessive use of alcohol and drugs. Those definitely alter your hormone production, your sleep, which affects your hormone production, all that good stuff. And you definitely do not want to use testosterone replacement therapy if you don't have low testosterone. That's going to cause a lot of issues for you. Okay. So that's talking about low T in the men, different treatment options and things like that. So just to briefly kind of go over low T in women, again, it's not something that I am treating yet. It's something I'm learning about and hopefully will treat at some point in my practice. But it is definitely an issue, especially as women are going through menopause and getting older, because it does affect so much of our lives. And just like men, it changes our sex drive and things like that. So testosterone levels gradually begin to decrease in women's 30s, but you can experience low testosterone at certainly any point in your life. The ovaries, adrenal glands, and other tissues and cells produce testosterone. Too little or too much testosterone can affect women's overall health and impact of their sexual hormones on their body. The side effects of testosterone on women are not necessarily fully understood yet. We still need a lot of research. When research was first being done in medicine, they basically viewed women as small men. And so most of the research was done on men and recommendations were developed off of that. What we have learned over the years is women are very, very different chemically and hormonally than men. We are not just smaller versions. And so more research really needs to be done in here, but we're getting there. We're getting people to start researching this. There are a lot of different methods for testosterone replacement for women, just like there are for men. So we went over that already, but we can definitely pick based on your symptoms. Obviously, these are going to be much smaller doses than the men are getting. But for women, testosterone is going to have an impact on your libido, so your sex drive or desire for sex. It has an effect on your bone and mineral health, has an effect on your mood and your energy, and also your menstrual cycle and fertility. So symptoms in women can be low sex drive, lack of energy and feeling tired, loss of strength and muscle tone, infertility or trouble conceiving. They can have irregular menstrual cycles, vaginal dryness, depression or anxiety, thinning of hair, dry, brittle skin, and difficulty sleeping. So really, obviously, a lot of these symptoms can be caused by many things, but if you're like, I have that, it might be worth having your testosterone level checked. This is very simple. It's a blood test, just like it is for our guys. So we definitely want to replace that for women who need it as well, because it does affect so many systems in our body. For causes of low testosterone in women, age is a big one. It is the biggest cause of low testosterone in women. By the time a woman reaches menopause, her testosterone levels may have decreased by half to what they once were. So people who have had their ovaries removed, they will also have lower testosterone because your ovaries are involved in the production of testosterone. And then other than age or your ovaries removed, it might be from a genetic syndrome called Turner syndrome. It may be because of a tumor on your pituitary gland, possibly from getting chemo or radiation. You can have ovarian insufficiency even if you still have your ovaries. You can have adrenal insufficiency like Addison's disease. Malnutrition, if you're not eating well, you can have low testosterone for our ladies. Hyperprolactinemia, which again is dealing with the pituitary gland. Hypothalamic amenorrhea, meaning the loss of your menstrual period from extreme stress, weight loss, or exercise. So we'll have women that come in who miss their periods because they are stressed or they are elite athletes. But that can affect your hormone levels, not only your testosterone, but other ones as well. And then premature menopause that happens before 40 years old can affect your testosterone. And just like for men, there are certain medications that can lower testosterone in women, hormonal contraceptives, so birth control, corticosteroids, anti-androgen medications, oral estrogen therapy, and opioids. So really kind of working through that. The testosterone, again, you're going to talk to them about their symptoms and check their blood levels. We can certainly see where you're at. There are different levels of testosterone based on where you're at in your cycle. So you may have a provider that asks you to get this done for several weeks in a row, so we can kind of correlate where you're at with where your cycle is and see whether or not this is truly a problem for you. But depending on your age is where we kind of want your testosterone to be. So low testosterone in a 30-year-old is different from low testosterone in a 50-year-old. We do not necessarily have a standard testosterone value for women like we do for men. But we do know that based on symptoms and levels of testosterone, watching them fluctuate, we can kind of help women determine where they should be at. So again, injections, pellets, creams, patches, pills. And the risks of hormone therapy for low testosterone for women, if they do decide to take it, you could get some acne, male pattern baldness, excessive hair growth, especially I'll see women have like chin hairs, ear hair, things like that in places that they hadn't necessarily had overgrowth before. It can deepen your voice, and this is one of the things that's not reversible. So if you try testosterone and it it deepens your voice, just because you stop testosterone, your voice may not go back to where it was. For some women, this is really upsetting, especially if you're in a field where you're talking a lot, singing, acting, being a public speaker. If it really affects you, that might be a frustrating thing for you, especially since it is generally not reversible. And then we have the enlarged clitoris. So that's definitely, much more of a male issue than a female issue in general in what I see in my practice, but we don't want to leave anybody out. So I did want to cover both sides of that. And hopefully I will be becoming more and more well-versed in low testosterone in women and bringing that into my practice as well. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday. Because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets. So the first story, it's a patient of mine, and he is a bodybuilder. So if you look at him, you would not think he has low testosterone. But his testosterone, when he is not on replacement therapy, is bottomed out. It's less than 100. And it has been for years. And so he is on therapy. We watch his blood count. We keep him in an appropriate range, all of the good things. And because he does such a great job in his workouts and his nutrition and all of that, and we've gotten him on the correct levels of testosterone, he has been very successful in the bodybuilding community. He does great at his shows, and he has incredible amounts of motivation to continuously get better and better. But I so appreciate in him that he keeps his levels where they're supposed to be. He doesn't go crazy with things. We monitor him very closely. And so it's nice to see that even in this area of steroid use, that is part of why we have controlled substance now on the testosterone, and it's regulated in that way, is because so many bodybuilders abused it. It's lovely and amazing to see a man do what he can do physically, mentally, nutritionally, to be the best that he can be, and then get appropriate levels of support with his testosterone. It's really cool. And he's a great man, does a lot of really good things. And certainly it's fun to watch him compete at his various levels. I have another patient who got really, really mad at me for not treating his low testosterone, what he thought was low testosterone. He did have some symptoms, but they were the fatigue and difficulty sleeping and things like that. He was not overweight. He was in good shape, but he didn't exercise. He didn't have good sleep hygiene. He drank and smoked regularly, drank alcohol and smoked regularly. And he got so mad at me that I would not treat his low testosterone and that I wanted him to do lifestyle changes first. And it just kind of made me giggle. Like, yes, I know we're an instant gratification society. We want the quick fix. We want the Ozempic to help us lose weight. We want all of those things. But sometimes you got to do the lifestyle changes first. But I'm pretty sure that he went ahead into a male clinic that isn't as concerned about the health side of things and is more concerned about getting the money for you. Not all of them are like that, but a good majority of just the testosterone clinics are like that. And so I'm pretty sure he went over there as that's what he threatened me with when I said I wouldn't treat him. But hey, I got to do what's best for my patients and what's healthiest. So I'm not going to treat you if you don't need it. And his ranges or his levels were well within the normal ranges. So they weren't even close where I would consider treating him based on his symptoms, even though he was in the normal range. Insurance coverage is pretty good, even if you do have to pay out of pocket if your insurance isn't covering you because you're not quite under that 300 mark. So that's really good to know. It depends on which product you use and things, but you can get it for pretty cheap now. So that's really nice for our guys who are definitely symptomatic and on the lower end of normal, but not quite low enough for their insurance to say, yeah, we'll treat you. I had a patient with very low energy, very low sex drive, really didn't even think about sex anymore. He has medication refractory ED, meaning Viagra and Cialis don't do jack shit for him. He's overweight. He has difficulty getting through his workouts. His sleep test showed sleep apnea. So he started using a CPAP. So once he was on that and in a good place there, then we started the TRT and he was able to lose weight. He got his libido back. He got his erections back and doesn't even need Viagra or Cialis anymore. He's getting great quality sleep at night. This is like the best quality of life for him. He is so happy. So this is a great example of somebody who really needed it and it has truly benefited their life. I love that for him. I think it's funny when we talk, when I'm giving my guys my speech of, pros and cons, possible side effects, and I talk about the testicles shrinking and guys freak out. Like I absolutely love my male patients. You guys love your penises and your balls so much. And it cracks me up when you get so concerned about the testicles getting smaller because you like your balls the way they are. But that always cracks me up. It's okay. They just get smaller because they're not working so hard, not because you're less of a man. All right. Women and low testosterone. I have a lady who does, obviously not from me, but she does go get 2 pellets put in every 6 months. And this has been extremely life-changing for her. She now has a great sex life with her husband. She has a little bit less vaginal dryness. She is also getting some vaginal estrogen with that. But it's been so life-changing for her. She has the motivation to go to the gym again and lots of things like that. So it definitely benefits the people who need it. We just have to, watch the safety parameters and not give it if you are on the higher end of normal. We want to figure out why you're having symptoms. If you are on the higher end of normal and it's not your testosterone, what's going on for you? Let us help you figure that out. And if you need testosterone, we are there for you because it definitely improves quality of life. Hope you guys have a great day and we'll see you next time on Between the Sheets. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories.